As we've discussed many times on this channel, the physical activity guidelines for adults is that they perform 150 minutes of moderate to vigorous aerobic exercise every week, and they also do some strength exercises 2 times per week. And the reason for this is based in many scientific studies that show that this amount of physical activity will help reduce the risk of early death, reduce cardiovascular disease, and also will help reduce many other chronic medical conditions. However, what is unclear is whether or not performing the same amount of physical activity, this exercise of 150 minutes per week, if we spread it out over several days, let's say 5 or 6 days, versus concentrating it into, let's say, 1 or 2 days a week, will it confer the same amount of health benefits and also help reduce the risk of early death? Or is there a difference between the amount of frequency? Because exercise on the weekend may be more convenient for so many people, this is an important question. Hi, I'm Dr. Edmond Cleeman, an orthopedic surgeon based in New York City. I specialize in arthroscopy and sports medicine. On this channel, we explore the science behind exercise, and we discuss strategies and tools for us to be able to live healthier, happier, and more physically active lives. In this video, I'm going to briefly go over 2 scientific studies looking at this issue. In the first study I'm going to review, which was just recently published, it looked at 350,000 people, and they looked to see the different exercise patterns. And they broke it down into 2 groups: the people that were exercising 1 or 2 days a week, which we would call the weekend warrior group, and then the other people who were exercising 3 or more days a week, what we would call the regularly active people. And then what they wanted to do was to see, was there a difference in early death rates between these 2 groups, early death for any reason or for a specific reason. What they found was that the people who were regularly active 3 or more days a week and meeting that 150 minutes per week had significantly lower risk of early death than the people who were not active at all. Now, what they also found was when they compared the weekend warriors to the regularly active people, that there was no difference in their mortality rates. Based on this finding, the study suggests that weekend warriors and regularly active people similarly will reduce their risk of early death. The other study that I want to discuss was published a few years ago, and what this study did is they pooled 11 other studies with about 60,000 people. And what they found in that group, that about 40,000 were not physically active, about 22% were active but were not meeting that 150 minutes, about 4% were the weekend warriors meeting the 150 minutes per week, and then about 10 or 11% were regularly active, exercising 3 or more days per week, and meeting that 150 minutes per week. What the study found was that these 3 groups, the one that was regularly active, the one that was weekend warrior active, and the one that was active but not meeting the 150 minutes per week, all 3 of those groups had significantly reduced their risk of early death compared to the people who were not physically active at all. However, there is a pecking order here. So the people who are regularly active, and meeting that 150 minutes per week, they had reduced their risk the most. The next group were the weekend warriors, and the next group, was the people who are physically active but not meeting the 150 minutes per week. On an interesting side note, this study found that the weekend warriors were more likely to be doing vigorous exercise. So this might indicate that to gain some of the benefits of being a weekend warrior might necessitate being higher intensity exercise. Wrapping up the video, what's the takeaway points here? The key is that any physical activity is better than no physical activity. Even those people who are below the 150 minutes per week but are getting some physical activity, they're better off than the group that's not active. If someone wants to be a weekend warrior because that fits their schedule, great, just do that and they will also gain benefit. But if you're looking to optimize the health benefits of exercise, then it appears that exercising 3 or more times per week is most ideal, and I would recommend 5 days a week at a minimum. You may want to check out my Phys Ed playlist where I review everything you need to know about exercise and how it makes us healthier and live longer. If you found this video helpful, please click the like button below and subscribe to the channel. Thank you for watching. I look forward to seeing you in my next video or maybe in my office.